What hospice does, what our greatest mission is to promote quality of life at the end of life. Hospice is emotion. We have patients that die while we're there, and that's hard to watch somebody's life slip away. But that's why we're there, and ultimately that's why a nurse is called to this profession, to be there. It's what an honor to be there for their last moments of life.
For a lot of our patients, there's just no place like home, and there's no place they'd rather spend their last days than at home with the ones they love. We don't want them suffering, we don't want them hurting, we want their families to be close by, their animals, whatever makes them comfortable, we want them to have that in their last days. We love our patients, and we do get very attached to our patients, but sometimes you have to be the strong one and to be there for the families.
We want to reduce caregiver anxiety, reduce doctor's visits and going back and forth to the ER, and keep them calm by providing constant education from our clinicians that are out there in the home.
Normally I start my day seeing my patients about 8 o'clock in the morning. As the nurse, we go out and make sure the patients have what they need. We make sure symptoms are under control. A lot of times we have to adjust medications and put them on additional things just to make sure that they are comfortable and that they have what they need. We also educate the family to make sure that they know everything that they need to be able to take care of the patient in the home.
Some of them don't hear the word terminal. They didn't hear from the doctor that there is no more treatment. So it's an education. The nurse is now having to educate not only about hospice, which the family might panic about that word. They're just on this emotional roller coaster. It's hard. So that's when you kind of have to put your pen down, look eyeball to eyeball with your patient's family, and just have a conversation. Coordination of care is our whole team. All of our field staff, our RNs, LPNs, aides, social worker, chaplain, volunteer coordinator. All of those people go out to the homes of our patients and they coordinate their care together. And then they all get together for an interdisciplinary team meeting. That's an opportunity for everybody to get together with our doctor and talk about these patients. You're not in this alone. You have a core group of people in this office. So if they hit the end of their road and they're like, I don't know what to do with this patient anymore, call in your social worker, call in your chaplain, ask the aide, what are they seeing every day in the home?
You can have on average 6 to 8 patients a day. It just depends on how your day's laid out. I usually go in the homes, I try to spend about 45 minutes with each patient. Sometimes you need to be there longer. We do have a lot of documentation, and sometimes we do, depending on your day, have to take some of the documentation home, but it's flexible. You know, if something comes up, you can always move things around and adjust for your patient's needs. You have a lot of flexibility with this job, but you also have to be responsible and be able to manage your time and make sure you get your patients taken care of and those needs met. The RN is the case manager for that patient, so we have a lot of responsibility. We make a lot of decisions, and a lot of times we have to do it on our own. We're in situations where you have to be able to act quick and make decisions for the best interest of the patient and the families.
Some of the qualities that I look for is, number one, they have to have a servant's heart. They have to really understand that they're meeting the quality of life of the patient. The goal is not to cure. The goal is to take care of these patients, and sometimes that means they're sitting there with their computer, but they've got to really talk to these families and educate these families. And of course, the electronic medical record is very important.
Home care home base is helpful because we're able to access all of our patients' information, all their medical records in one place.
Home care home base is our medical platform, our electronic medical platform, and it tracks mileage for them. It will set up a GPS system, so I'll tell them the best route. They can look at previous visit notes, patient education. They can look at all their medicines. They can talk all about and educate about the drug and the side effects. So it's that teaching moment that's so important to keep hospital readmission rate down. So we want to make sure that along with that servant's heart, that they can understand the capacity of how to work on the computer as well and integrate those two. As a hospice nurse or clinician, you're going to find yourself in a lot of different home environments, and you have to ever change and never be judgmental. That's where the patient lives. We have to honor and respect that. It is emotional work, and it's hard. You get involved in these patients' lives. The nurses are there 2, 3, 4 times a week. The aides are in there every day. You're part of the family, and that's something you don't get in a hospital setting or a doctor's office setting, or even in a long-term care setting. It goes back to the servant's heart. All they want to do is take care of this patient. And that might not mean a medication. That might be there holding their hand and putting their dog on their bed so they can pet their dog. I've been doing hospice for 19 years. I couldn't imagine another profession where we get to really be there with a patient. You really have an opportunity to do what you have gone to school for, and that's to really have an impact emotionally, physically with this patient and their family.
This work is very rewarding. You feel like you really make a difference in the patients and the families when it matters the most.